Ghana's population stands at 30.8 million, a 24.6% increase over the 2010 figure, according to the 2021 Population and Housing Census. Exponential population growth requires corresponding infrastructure in the area of sanitation, safe drinking water, and hygiene facilities, among others. However, according to UNICEF's 2021 WASH Budget Brief report on Ghana, 18% of Ghanaians still practice open defecation, while access to basic sanitation stands at only 24%, well below the national vision for sustainable basic water and sanitation services for all by 2025. The situation threatens the achievement of SDG Target 6.2. That is, to achieve access to adequate and equitable sanitation and hygiene for all, and end open defecation, paying special attention to the needs of women and girls and those in vulnerable situations. Thanks to Plan International Ghana's integrated package for sustainable development, I-PADEV, being implemented in 20 communities in the Jarsekan district in the Oti region and the West Mamprusi district in the Northeast region of Ghana. The project started in November 2022 and ends January 31, 2026, seeks to address these challenges.
Prior to the design of this project, Plan had implemented several other WASH activities, some basically tailored towards sanitation, some tailored towards provision of water, and some hygiene. We realized that when you implement a water project in providing water, at the end of the day, if you don't take care of sanitation, the water you provide may serve as a way of transporting diseases to community members and thereby affecting children in particular.
We have about 150 communities in Buem. And then out of these 150 communities, I would say that about 70 of them are very deprived, where getting access to potable water becomes a problem. The kids have to travel miles in order to get water to drink. And I think that Plan Ghana coming in to help us is a good intervention.
This project seeks to combine or integrate all the various components of WASH, which includes provision of water, improved sanitation, hygiene, and then also health. So that at the end of the day, you have a whole package that tackles issues of WASH at the community level.
The 1,474,759 German National Office funded project would contribute to creating a resilient and protective environment both at home and school for better health and learning outcomes for children, particularly girls, through equitable access and effective utilization of WASH, early childhood care and development, ECCD, education, health facilities and services. The project targets 18,668 direct beneficiaries made up of 9,453 women and girls and 9,215 men and boys. These include 10,094 school children comprising 4,957 boys and 5,137 girls. Indirectly, 36,000 community members are also benefiting from the project. It is estimated that more than 40% of basic schools in the country do not have sanitation facilities. School children therefore engage in open defecation and waste learning periods to use public toilet facilities mostly located far from the schools.
We don't have any toilet facility in our school. Before we go to toilet, we need to go to the bush, and sometimes we go to the house, and not all the houses that have toilet.
Some of the people will go to the bush, and some too will go to their various houses before they can ease themselves.
Sometimes we miss class and it is affecting us.
It affects us more because a child will go to the house to ease his or herself. So by the time the child will come to the school, it will be maybe 30 minutes time or 1 hour time. So by that time, we can't wait for the child. So we will continue teaching those in the classroom, so the child will be affected.
We don't have any water in the school, and the pipe at the tank is also spot. So sometimes when we are going to fetch water, we need to walk far away from the school before getting water.
We are having a stream which is called Menu, and as for the Menu, some people go there and swim in the Menu, they go and wash. And also they are farming along the riverside, so it has been contaminated by the chemicals and various things for their farming.
We have been trying our best to raise funding from our internal generated funds and part of the District Assembly Common Fund to finance wash activities in our municipality. But unfortunately, the DACF has not been very regular, and the amounts that we expect most of the time are not transferred. And for that matter, we are unable to implement all our plans as far as wash activities are concerned.
In Ghana, 9 out of 10 girls miss school during their menses due to their inability to properly manage their menstrual hygiene. The lack of safe and clean changing rooms and difficulty in accessing sanitary pads leave many teenage schoolgirls no option than to use unhygienic materials such as pieces of cloth, papers, among others, to soak their monthly menstrual flows. Period poverty strongly linked to SDG 1, no poverty, SDG 3, good health and well-being, SDG 4, quality education, SDG 5, gender equality, and SDG 6, clean water and sanitation.
If you get the menstruation at the school, if you have things in your bag, you will go to the facility and go and change, or you will go home and go and get money from your mother, or when your mother didn't get the money for you, you will go and use cereal or napkins.
I visited a place after Accra, that is Trikasa, which I know that Pan Ghana is not covering there. I wish that it is added very soon, where a child between the ages of 13 and 15 had to come in and say that he uses tattered rags to save the menses when it comes. And I think that it was alarming.
% or 2.1 million rural Ghanaians use unsafe water sources, and an additional 1.6 million travel more than 30 minutes to collect water, according to UNICEF. This is contrary to SDG Goal 6.1 relating to universal and equitable access to safe and affordable drinking water for all. Many schools, such as Manga MA Basic School in West Mamprusi, district of the Northeast region, do not have access to safe water, affecting personal hygiene and menstrual hygiene management among girls.
Where the people get water to drink is far away from the school. They have to move a distance not less than 1 kilometer before they can get access to drinking water. We don't have any sanitation building like toilet and urinal pit. There's nothing like that in the school. The children have to go to the bush to free themselves when the need arises. All these things take some of the instructional period in the school. There's nothing like a good infrastructure for us. The KG1 and KG2, they sit under tree, where we box the other students into the 3 classroom block, which was built by the community. So you can see that Form 1, P6, P5, we box them into 1 class. P4 P3, they are also into one class. Then basic 1, basic 2, they are also into one class.
The situation is not different at the Zanguga and Gbani communities.
We face a lot of water problems in the school.
There is one borehole, but it is not working anymore. So we went to the town to fetch water.
We have got only one pipe hole, which all the community is just using. And it is not fit for us. Every time the women have been fighting here.
Because we are asked to share our water with the community peoples. That makes us go to fetch water. When we go to fetch water and they are there, we can't tell them to move away for us to fetch. We have to wait for them to fetch the water and finish before we can also fetch.
Jesse anti yanyina ya pre pese okwa efuma na e hawo wo pe adwuma akwaye wo fie ntema nsuo nti adwuma no ekwa ekire en content ma nti nsuo na ho asam de aya hawo pa ma.
We mostly miss lessons.
And when you are in a hurry to go back to the school class to study and you are out to drink water, you have to wait for them, and what they may teach in the class may affect you because you don't know what they've learned and you are outside.
With regards to water, I think we are facing a very big challenge because the people will have to leave the school and walk about a kilometer to go and then get the water. And the water they even get is water from the spring or from the well. That is where they source their water.
Sometimes when they come to school, they have to leave the class and go home before they will go and drink water and come back. So by the time they will come back, we have completed part of the lesson. And others also go without coming back to the school at all.
Every morning or even in the night, they will stand here till 11 o'clock, no water. And this time again, it is getting to dry season now. The water is not sufficient. So we are appealing to you people that if we could have get about 2 boreholes to add, then it would have been good for us.
Halika kuru yin nga tetongwa ma sami kira pampa ngwatin jo ma biyo kam to ku zabala ko ma zaba to zaila asna mu pompa ma te pompa kana halika kati yir ko ju ko ma kalan su sugu chaka iki na shi pompa ma ni iko mana halika ditu zibiki pamwa sabo ka biyo nya yani ki yanya ko ntibi se ka ba su ka chan sukuru ba ti ya chan sukuru be nga late.
And when you are in your period in the school, you don't feel comfortable changing yourself in the school because you can see that other of your colleagues are there. You feel shy to change whilst they are there. So some of us get back to the houses to change ourselves or bath and change ourselves and come back to the school, but others do not come back to the school because maybe they don't have the power to use, or they'll use racks to do, and they don't feel like coming back to the school until their menstruation stops.
Some key implementation activities of the I-PADEV project include construction of hand pumps, mechanized systems, and extension of pipe to 20 communities. Additionally, 20 girl-friendly institutional latrines have been constructed. Community-led total sanitation implemented in 20 project communities. Vulnerable households supported to construct and own improved latrines. Menstrual management and hygiene education and distribution of reusable sanitation pads to schoolgirls. Member of Parliament for Buim constituency Kofi Adams described the I-PADEV project as a game changer.
Water supply has been a challenge. If you take out just Sikan, the rest of the communities don't have anything connected with Ghana Water Company. To implement integrated development projects, i.e. water systems and toilet facilities for sanitation improvement, for me, is a game changer.
Suleiman Agbena, Southern Program Influencing Impact Manager at Plan International Ghana, is hopeful the sustainability of the project will maximize impact to meet SDG targets in the beneficiary communities.
Sustainability of projects all over has only been a challenge to every development organization, not just only NGOs, but what governments. But what we normally do as Plan International that is unique is to ensure that we start the planning with the people. As I mentioned, based on our country strategy, We have deeper consultation with communities. We have deeper consultation with children. We have deeper consultation with government departments and other development NGOs. And based on that, we develop the country strategy. And any other project that we are going to define, where we have to go for, it is guided by the strategy we have. And because the communities and all the stakeholders were involved in the whole process of our council strategy, it becomes the benchmark for it to be able to move. In addition to that, we have also worked with the communities currently to also develop their community development plans. And they have identified the issue themselves and also indicate what is the way forward.
Project manager of I-PADEV, William Dompiela, is also empowering the communities economically through a savings and a loan scheme.
In these VSLA groups, they are going to come together as a group to keep contributing among themselves and putting down. Others within the group are able to come and even take loans to go and solve their personal, family, or even the community problems. And in doing so, you pay back with commission. At the end of a certain period, these monies and commissions are all put together and there's a share out. When they do this, they are able to sustain themselves financially and able to undertake their community issues and household level issues.